Welcome to Podcast 83, a regular look at the news, stories, and trends related to Michigan's 83 counties from the Michigan Association of Counties. Brought to you in part by Comcast, bringing the power of the internet into Michigan homes and businesses. Now, here's your host, MAC Executive Director Stephen Currie.
Good afternoon, everyone. Welcome to Podcast 83, our semi-weekly podcast we put on. Sometimes weekly, bi-weekly, monthly, whenever it works into our schedules. So thanks everyone for joining us. Of course, we're joined this week by Deena, Bosworth, Meghann, Keit-Corrion from our MAC staff. Things are definitely getting back into the swing of things here after the new year with budget changes, other bills. So I was going to bring up a topic that I saw an article on about goat yoga, because it just still baffles my mind what goat yoga is, but I figured we'll bypass that. We'll save that for a little bit slower week, and we'll just get right into things today. So first, Meghann, we've got these mental health bills. The Senate Majority Leader has a package of bills he's been working on. Meghann, why don't you give us a little background on those bills and where we're at with those and what MAC's been doing to help work on those?
Yeah, absolutely. Piqued my interest though with the goat yoga. It sounds like it's right up my alley. So we'll have to go back to that at some point. But it sounds like maybe that could help some people with their mental health if you go through this. So good transition there, I think. But seriously, we've had Senate Bills 597 and 598 that are, really spearheaded by the Senate Majority Leader Mike Shirkey himself, that have been introduced now since last year. MAC, really started engaging and meeting with his staff even when they were in draft form, trying to educate, talk about the good work that a lot of our local CMHs and the collaborative community process that we have through county government is doing right now. And that some of the proposals through Senate Bills 597 and 598 would really kind of unravel some of those good practices and community collaboratives we have. So the bills ultimately shift what our current community mental health function under the mental health code does to these specialty integrated plans, which the criteria under those specialty integrated plans are really, it can only be met by their private Medicaid health plans. So it really takes the function of what our CMHs and the administrative and management functions under our PHP system that's really run through that county commission board and appointment process. It really takes all of that and shifts that to our private Medicaid health plans. So we've been actively opposed to a shift towards a privatization system. MAC's platforms have long held that we want to maintain our local public mental health system. And we've partnered with not only those in the CMH community, but those in our law enforcement community, our Sheriff's Association, Judges Association, family court administrators, to really oppose this together. MAC testified in the Government Ops Committee in front of Senator Shirkey, who chairs that committee. Our CMH partners, of course, did. We submitted a letter to that committee and to the Senate as a group stating our opposition and our concerns with these bills. And since then, we've talked to a lot of members. I think a lot of the senators want to support their local CMHs, want to support their county commissioners, but it's a really complex, complicated issue. So I think, there's been some time over the past few months where, some of the other groups on the other side of this, the Senate Majority Leader, have really been trying to connect with some senators, and the time's basically come where we have been hearing there's a vote this week,
for
likely on
MAC.
Wednesday. Likely on Wednesday this week. And so we're really trying to rally anyone and everyone. If you haven't reached out to your senators at this point, please do so. Please, talk to your CMH director, talk to your sheriff, to your judges, They're, through their associations. Hopefully you guys have received a lot of information through MAC already. If you need anything, please let us know. But we also have our advocacy center that's open on this right now, which is just, a 2-click process. I think maybe 1 or 2 clicks. It's pretty simple to send an email to your state senator to express some of the concerns from a county commissioner standpoint. You can edit that text if you need to, but we try to make it as simple as possible so you can just click that, 1 button and send that email to your legislator. Of course, any texts or calls are also greatly appreciated, because we know it is certainly, being pushed this week. They want to get that up for a vote, and so we need kind of all hands on deck at this point.
So, Meghann, I know that we're absolutely opposed, and when MAC agrees with, keeping community mental health decisions at the local level. What is Senator Shirkey purporting that this is really going to fix? So when they go to call him or they call and talk to their senators, how do we debunk that?
Yeah, I think, the advocates behind it are really the health plans, Medicaid health plans, right? So they have everything to gain. They take over the system, they manage the dollars, who gets services, who doesn't get services, and then any overhead or any administrative cost, that's going into their bank accounts, right? And so I think that's a huge concern, particularly from the county commission standpoint, where that money is not being managed in a public way. It's not being governed by anyone that's elected by the taxpayers. And so I think, while the Senate Majority Leader feels like this will be able to, integrate the system, people will get better access to care, they'll be able to take care of the whole person. It really doesn't do anything. It just really takes who's sending the check, who's making those financial decisions. It doesn't have promises to increase access to care, to address the lack of inpatient care that we see in the state. There's really no guarantee that will improve or create better outcomes for those that are using the system. So it's really, I think, simply for the health plans, a way that they can manage those dollars from the state and the Medicaid money that would flow to them. And I do see who's in support of this bill, mostly downstate. I don't know exactly if you want to talk a little bit more about mostly downstate, what you mean by that, but it really is something that's really being supported by the health plans, those insurance group that would benefit from that. I think as far as the state, from a county commission standpoint, it's something that we've seen 43, I think over 43 county commissions now sign resolutions in opposition. Doesn't matter if you're, large county, Oakland County, Wayne County, or a small Upper Peninsula county. Doesn't matter which side of the aisle, we've seen opposition across the board from our county commissioners.
Yeah, definitely a hot topic around all of our committees, our board, some great discussions going on all across the MAC environments, MAC platforms on that. So thanks, Meghann, for doing that. A couple housekeeping items. First, we want to thank Comcast for being a sponsor. We obviously, with broadband being a hot topic, Comcast has come on board, so we appreciate that. If you do have any questions, you can feel free to type them in the chat or raise your hand at any point. We'll be happy to answer them in either of those ways. And also, if you could also just make sure you mute yourselves, that'll help make things run smoother. So moving along, Deena, we had a kind of a last minute, I guess you could say, legislation come out the end of last week. Caught a lot of people off guard a little bit on the proposal. We're calling it the Local Government Pension Tax Reduction Plan, I guess, is what we've kind of named it internally. I don't know if there's another fancy name or not. But Deena, why don't you talk a little bit about what that does and what the intent is of that legislation?
Absolutely. Thanks, Steve. So like you said, last week, the House Appropriations Committee called a joint committee meeting with the Tax Policy Committee. And in that committee meeting, they took up House Bill 5054, sorry, 5054. And that is an appropriations bill that appropriates state general fund dollars, not the federal ARP dollars, but state general fund dollars in the amount of about $1.5 billion. And from that $1.5 billion, they provide $250 million to shore up the state police public pension system. They also then they set up for local governments 2 different grant programs. The first grant was for about $900 million, and that would go out to whichever local units of government apply until they run out of money. As long as those local units are funded at 60% or less in their pension system. Not your pension and OPEB together, not OPEB, but just your pension. And so that $900 million will go out in the form of grants, and then there are strings attached to it. So it would be, you can't enhance your benefits for 10 years. You have to be subject to a corrective action plan for 5 years. So Department of Treasury will really monitor what's happening and making sure you're making those payments. If you violate those, you'll have to pay it back. There's also conditions on mortality tables and discount rates and rates of return, and those things have to stay static as to where they are right now. In addition to that, there's another pot of money, another $250 million that would be eligible for all of those local units that are over 60% funded in their pension system, that they could apply for a grant. No more than about $12 million in that one. The big one, it was no more than $100 million, so that's a huge chunk of change. But the smaller one would really affect our members, because when Steve and I looked at the spreadsheet, I think there were maybe 4 counties who were teetering right around that 60% funded in their pension system. The other 250 million, so that second pot of money could go out for those that are over 60% funded, as long as you put it towards your pension obligations. If you apply for the money and you are awarded it and you don't have, and you're already 100% funded in your pension, you can put it toward any other debt obligation. I'm getting into the details of it, but we don't really know what's going to happen here. Like Steve said, this was pretty much a surprise. It just was. I mean, they kept it pretty close in-house. We know that Representative Albert, who is the House Appropriations Chair and a big advocate for shoring up your pension system, has been working on this for a little while. But he notified his members and, members of the other side of the aisle and everybody else just the day before he ran this in committee. And so it's passed out of committee. It's sitting on the House floor. We're assuming it's going to be part of different budget negotiations, because this is high up on his priority list. But we don't know necessarily where it goes from here. It was interesting, though.
Yeah, and an interesting concept for sure, when we're talking about shoring up pension plans and the best ways to do that and who benefits from it. Obviously we want to see healthy local governments, but is using state funds the best way to do that? I think there's an argument on both sides for that. So we'll kind of see how things play out on that as the legislation moves. Moving on a little bit, something we've been working on for years, after the legislation passed, I think it was 2013, was a fix to the veterans property tax exemption. That local units of government had to absorb those dollars. We've worked on various plans over the years to try to fix that. Deena, you want to talk a little bit about finally where we're at right now? There's competing pieces of legislation. We like some more than others. Why don't you talk about mainly the one we like right now and where that is?
I don't want to confuse everyone. There's 2 out there that I'm not quite sure viable and we wouldn't necessarily get behind. But there's one package of bills, Senate Bill 783 and 784. Those are sponsored by Senator John Bumstead. And they were up in the Senate Finance Committee for testimony last week. What the bills do is they still require a 100% disabled veteran to go in and apply for their exemption each year, but the form would change a little bit. And so they would be applying for the exemption, but also allowing that exemption account toward a refundable income tax credit. That income tax credit form would be sent to the Department of Treasury, and local units would be reimbursed through that mechanism. So in other words, we'll be reimbursed for our losses through a homestead income tax credit that the veteran helps us fill out and send into the department. It is by far our preferred method for getting reimbursement to local units of government for that tax exemption. It holds the local units of government harmless. It puts the burden to pay for it on the state. And most importantly, it changes absolutely nothing for the 100% disabled veteran. They're already filing a form every single year to get this property tax exemption. So in beautiful fashion, all of the veterans groups testified in support of, three of the veterans groups testified in support of the legislation, and all levels of local government testified in support of the legislation. It's not a done deal yet, but it was a fantastic first step. We're going to continue conversations and hopefully see it back up again in the next couple of weeks.
Yeah, some good news there. And I think it's great when we can still help out our veterans, but still make sure we're getting reimbursed for those dollars from the state so we can provide various services that not only benefit the veterans, but benefit everyone at the county level. So good job on that, Deena. And I'll kind of open this up for both of you, this next topic. You know, it's something that we talked about obviously a lot during COVID was remote meeting participation. You know, that ability to participate and vote remotely kind of ended at the end of 2021. Here we are 2 months into 2022. Still a topic of discussion. Meghann, Deena, why don't you fill everyone in on kind of where those discussions are at this point?
You want to take it, Meghann? You take it.
For sure. Yeah, we saw the expiration of remote capabilities at the end of last year. With amending that statute, it really set a deadline for any type of remote meeting. So prior to the pandemic, there was legal interpretation where if you had a quorum physically present, you could have certain members participate and vote remotely, so long as that quorum was physically present. And really with the changes to the law and that hard, fast deadline, now that's not even allowed under the statute. So, we heard from some counties, we heard from, a couple of counties that found it hard, and even some local government groups that work with MML and MTA, where they were finding it very difficult to actually get quorums because they didn't have enough members that were able to participate, or they were sick or were testing positive for COVID in January and February. So they're really having a hard time to, govern under that situation. So we partnered with some of those organizations, school board organizations, council of state governments, signed on to a letter asking both the House and Senate local government chairs to really look at this issue, maybe look at an extension for full remote, at minimum, get back to pre-pandemic rules where if we had a quorum physically present, then we could have some of those members vote and participate remotely if they chose. So we submitted that end of January to the chairs. Haven't gotten a whole lot of feedback at this point.
Well, but we had a little bit of feedback before that, though, too, because I think, Meghann, you met with House Legal Counsel, correct? And had some phone calls, conversations there, and
after
governor's office.
Yeah, we talked to or submitted that letter. We've had conversations with House Legal Counsel, conversations with the Speaker's office. I think everyone's getting to the point where it is, they know they need to revisit the statute, know they need to clean it up. Not sure that there's a whole lot of willingness to go, to really look at remote meeting participation. But we'll certainly continue to push for that. But I think at the end of the day, what's occurred over the past 2 years is carve outs for certain groups to have remote capabilities, which is really creating inconsistencies among the Open Meetings Act, depending on which type of board or council or state entity you are. And it's really becoming confusing. And the governor's office is basically saying, I'm not willing to sign any more bills that are just carve outs for one organization or the other. So I think there's a willingness to kind of look at what can we do to really streamline OMA. On our list of things that we've submitted is, of course, some remote capabilities to at least allow the locals to have that option. I know some county boards, even prior to the pandemic, even though that was an option, they could have made their own set of rules saying we aren't going to allow our members to do that, which is fine. That's what that local group determined. So I expect some more conversation. I think it'll be a larger conversation about Open Meetings Act in general. How can we clean this up? How can we make this more easily understood by the general public, ensure accountability, transparency, and then, try to get some of those considerations for additional remote capabilities. So I expect it to be a conversation. I'm sure it's just not as quickly as some of our members would like. It's not as quickly as we would like, but we continue to push for it.
Yeah, and it is something I hear a lot of support as I'm going around doing meetings across the state from various counties, even counties that say, hey, we don't want to do it, but we would like to have it be a local decision if we wanted to do it. So I think it's great that you've kind of put a group together, a nice coalition of groups that are kind of the same page with that. So hopefully we'll see some movement on that, as the budget kind of gets settled down. We're still kind of coming off a budget high year. There's some supplementals moving through. Might be an opportunity here in the next month or so to see some movement on some other.
I think there's a willingness to talk about it, and it's good that more and more people are talking about it. Even the governor's office has weighed in that they know that it's a problem. So if we talked about it in committee and came up with some suggestions, and yeah, Megan's right, we're probably not going to get to full remote, but I think the last year has shown that virtual participation, at least among the public, was very successful, and we were all able to govern virtually for the past year and a half. So they need to be a little bit more reasonable, and I think that we'll gain some traction, hopefully before summer. I don't know.
Yeah, and even when you look at what we did some polling nationally on what other states are allowed to do, and we're certainly not out, out on our own on this. There's a lot of variability across the country as far as remote voting and who can allow what. So it's something we're definitely not the only ones thinking about or doing. So it's good to see that as well. Meghann, we have another opioid call this week, I believe.
Yeah, on Wednesday at 3:00, we are hosting in partnership with the Michigan Municipal League and the Townships Association. And we're bringing in the Attorney General's office as well as Department of Health and Human Services to really talk about the opioid allocations that are going to be going out to our counties directly here soon. Prior to, I think it was the end of the year, we did some calls and some webinars talking about how to participate and what that sign up and that registration looked like to receive those funds. All counties did participate in that. And so this is now kind of when you can expect to see the money, reiterating some of the settlement eligibility, kind of the parameters around some of those funds and what they can be used for, as well as bringing in DHHS to talk about some of the best practices, some of the state priorities, giving you guys resources to utilize when you're making decisions on how to spend some of those dollars that are going to the county. We have partners at MML and MTA that will be on there because, of course, some of the cities and townships that are participating are getting direct allocations. And so I think there's a lot of room to coordinate with them, try to figure out maybe, how to utilize all of those funds together for some of these, prevention practices or educational material that some of the money can go to. And then, maybe even regionalizing. So maybe multiple counties want to come together and help support some programs in their area. So this is really just a broad overview on Wednesday at 3:00, starting at 3:00 to 4. I expect that the Department of Health and Human Services, probably starting later in April, will also have very in-depth seminars that talk about strategic initiatives on harm reduction, prevention plans, kind of go into the weeds a little bit more. So this is going to be kind of a longer series, but on Wednesday, it's just a broad overview that we're hosting with our partners, and Q&A will be available. So if you guys have any questions, burning questions that day, you guys will have ability to ask some of the experts at the state level.
Yeah, great. So that's Wednesday at 3 o'clock, correct?
Right.
Great. And then finally, just a plug for a conference coming up here, March 21st through 23rd here in Lansing. We've got a great lineup of speakers ready to go. The governor is expected to present on Wednesday morning, I believe. So hopefully, if you're not registered, you will be registering. We still have our early bird rates available, so you can get a little bit of a discount there. Love to have as many members there as possible, and staff as well. So would be happy to open it up for questions at this point. If you have any questions, feel free to type it in the chat. Derek, are there any that I missed? Or
No questions. We dealt with Art's question, Meghann did, and other than that, no questions so far.
No goat yoga questions apparently either. So that's, people apparently are better versed on goat yoga than I am. So that's good.
Yoga. Where does he come up with this?
I don't know. I just saw something on it, and it didn't make any sense to me on why someone would want to do yoga with a goat on them, and it just was weird. Thought maybe you two would know a little more about it.
He does this every time. We talk about what we're going to talk about on these podcasts, and every time he gets on and he throws something bizarre out there to start it off. I don't know what to do with him.
Makes it organic.
Keep us on our toes.
Yeah, makes it organic.
Quiet group today.
It's Monday. It's a Monday. All right. Well, if no questions, thanks everyone. Yeah, go ahead, Deena.
I just want to say one thing. We talked about that pension. What did you call it?
Local government pension debt reduction plan.
Yeah, that bill. Just remember that, although there may be some counties out there who might be eligible for a little bit of a grant in that first pot of money, I think what we're really going to try and say is it's great, but it's not necessarily for us. So, if you're talking to your legislators and they say, hey, we're pushing out a huge pension relief bill, just to help out local governments, they need to know it's not necessarily for counties. Not that it's bad, but it's not necessarily for us. So
it isn't for counties.
It is. We're eligible, but it's not. Most of our counties are at that 60% funded level. Yeah.
Okay.
Yeah.
But we are eligible, Mary. Sorry.
Yeah, definitely eligible, but yeah, it's definitely, most of our counties are right around 60% or better funded. So, all right.
Yoga with Tom Brady, really?
That's a good play on words. I'm assuming that's Bud who's doing that one over in Brand for us there. All right. Well, thanks everyone.
I see a hand. Mike Basonic actually has a hand up.
Oh, he does? Oh, there it is. Okay, yeah, go ahead, Mike.
At first blush, the pension bill that's out there, maybe it's me, but it seems like we're simply rewarding poor performance. I mean, a lot of the things that they're going to give you, if you qualify and you get the money, were all best practices that you should have been doing anyway. And so we're going to kind of take general fund tax dollars, give it to municipalities who, maybe didn't do what they should have done, gave too rich of a benefit, didn't fund it properly. I mean, there's a whole host of reasons why you could end up being under 60% funded. But for the other municipalities and those leaders of those organizations who maybe didn't give as much of a raise because they knew they had to meet that pension obligation, what does it say for them? I don't understand the rationale behind the legislation that's being proposed. I mean, are they rewarding people? Is that their goal, or are they just trying to bail people out? And why are you bailing them out? Make them make the tough decisions first, and then if they don't get traction in what they need to do, then we've got a different story to tell. But right now, the way I read it, you're just rewarding poor performance.
Yeah, I don't think we can predict the rationality of the legislature, and ever. So I don't think there's a good answer to that as to what their intent is. Now, I think you do bring up a good point. If you do take the money, you're beholden to their rules. So keep that in mind. If there's a grant there that an entity is going to take advantage of, there's a list of rules there that that entity's going to have to follow for at least the next 10 years. So it's if you're going to take the money, you got to follow their set of rules. But definitely understand what you're saying there, Mike. Any other questions?
Thanks.
All right. Well, great. I don't see any other questions in the chat. No hands raised. So thank you, everyone. Of course, if you have any other questions, please feel free to email any one of us and we'll get you an answer as soon as possible. And thanks for participating today.
Thank you for listening to today's episode of Podcast 83, brought to you in part by Comcast, bringing the power of the internet into Michigan homes and businesses.